to get and stay out of pain. By the way, we are recording this. All right, so here we go. Biggest myth that keeps a lot of people limited by pain is that lots of rest is going to help you heal and keep the pain from getting worse. And a lot of times your experience will inform you that this seems to be a good strategy, because when you exercise, even if it's just going for a walk and doing something that you used to do without a problem, now your knee hurts or your hip hurts. And so it seems like the best strategy is actually to rest. But the problem with that is that you're just getting weaker as you're not doing the normal activities that you're used to doing. And as you're not doing those activities and you're getting weaker and then you're doing less and less, then that actually contributes to the pain. And so it's really important, if you start having pain that's limiting your daily activities, that you work with a specialist who can actually solve that problem for you and lead you on the path to solving the problem as soon as possible, so that it doesn't turn into a problem that takes a long time to fix. So let's move to the next myth. All right, so the second biggest myth, and I hear this all the time, is I have cartilage tears, degeneration. I've been told that I'm bone on bone, and I've been told I need surgery. That's my only option at this point, and that's why I have pain in my knee or pain in my hip. And the truth is that 50% of people without hip or knee pain on an MRI or an X-ray, it shows that they do have these degenerative changes. So that's what we know from the research, that if they take a group of people, especially if it's a group of people over 50, and they do X-rays, MRIs on these people, then they're going to find 50% of these people have degenerative changes in these joints, and these people have no pain at all. So degenerative changes on an MRI or an X-ray do not necessarily explain pain. And that's a really important truth to understand, because there's a lot of hope for those of you, if any of you have been told that you have degeneration in your hips or your knees, if you've been told you have cartilage tears, research has actually shown that 3 to 6 months of high quality care that's non-surgical, not pills, not injections, can actually reverse the problem to the point where you can go back to your normal activities without needing the surgery. And the truth is that people who have cartilage tears in their hip or their knee, degenerative changes, if they end up having surgery, then they're going to need 3 to 6 months up to a year of physical therapy anyway. So why not get the care before the surgery and avoid the surgery if you can? And that's what we end up doing here for a lot of people, is help them. They've been told they need surgery, and then they get back to all of their activities that they did before without needing the surgery. And that's the good news. I'm going to teach you some of these strategies today. It's going to be fun. Okay, so I wanted to show you this concept of trigger points. So even if your joints are wearing thin, which is a normal part of the aging process, then if your tissues, if your soft tissues around the joint are working optimally, your joint is going to be pretty happy. So the thing that makes joints unhappy is when they get compressed excessively. And if you have the proper muscle balance, then they're not going to be excessively compressed. If you look at these pictures right here, we have trigger points that are causing pain in the front of the hip that can feel like the kind of pain that people get from degenerative changes in the hip. And the truth is that you might be having some referral pain in your knee or your hip that is because the cartilage is unhappy, because it's getting squished. But if we can decompress that hip by getting the mobility of the soft tissues optimal, and if we can strengthen the muscles around the joint optimally, then that compression is going to come off of the joint and it's going to stop crying. And if you have the right balance to your muscles and you have the right flexibility, then trigger points are not going to develop. So what trigger points are is they're areas where the muscle has gotten really tired, it's fatigued, and so because it's fatigued, it gets a very high amount of electrical activity going on, and then it gets real sensitive. And so when you move, it'll hurt. And sometimes it just starts to hurt all the time. And they've actually done research. They've shown that the electrical activity in the area where a trigger point is excessively high beyond what's normal for a muscle. And the good news is that trigger points can be released using various forms of technology, as well as using hands-on techniques. But if you keep having trigger points coming back, it's because you have imbalances in your muscles. So we're going to talk about some common imbalances and what you can do at home right now for that to address it. All right. It's important to keep in mind these principles. All right, let's move to the next slide. Another thing to understand is that muscles are connected by fascia. So give me a little wave if you've ever noticed the shiny stuff in between the muscle fibers when you're cutting chicken or beef before you cook it. Have you guys ever noticed that shiny stuff? Yeah, right? Okay, so that's fascia. So that's the connective tissue that holds the muscle fibers together. And at the microscopic level, this is super, super, super cool. At the microscopic level, that fascia is connecting the fibers together to a point where you can't even see it. It's like all the way down to the microscopic level. And the fascia also is around your nerves. It's around your blood vessels. It's protecting you. It's connecting big bundles of muscles together. And it's also connecting the bundles of muscles to the bone. So the reason that's important is because for a long time, scientists thought that the fascia was just packing material. It's not too long ago, even when I went through my doctorate program in physical therapy, when we were doing anatomy and we were going through dissection, they didn't really talk a lot about fascia. Basically, we were cutting it out and putting it in a bucket. So it's that might sound a little bit gross, but I definitely respect the people that have donated their bodies to science, because it really helps doctors to learn about the body and understand it when you've actually worked with a cadaver. And the thing that's really interesting is when I was going through my program, I had already been exposed to these ideas that fascia is much more than packing material. And there's actually a lot of research on this now that's been going on for about 15 years. And by the way, 15, 20 years is a blip in the world of science and medicine. So 15, 20 years, this information has gotten out to clinicians, but not everyone. And it's about 1% of clinicians that really stay on top of all of the latest science, because there's just so much going on and it's hard to keep on top of it all. And so these concepts of how fascia connects muscles together, it's important for you guys, because if you're seeing a clinician, a doctor or a physical therapist or a chiropractor who doesn't understand these concepts, then they're missing a really important key to what could be solving your problem for you as far as pain goes. And I'm going to explain one little thing about this so you can kind of get the picture. So how many of you have had tight hamstrings? Give me a thumbs up, in your comment, or give me a wave if you have had tight hamstrings on a chronic basis. It just seems like you always have to stretch those hamstrings. Anybody in the room with that? All right. Anybody know of anyone who's had that? It seems like they're always stretching their hamstrings. That's these muscles right back here. All right. Ever just constantly feeling tight back here? How about if anybody ever feeling like constantly tight in the hip flexors? Just always feels tight in the front or in the front of the hip. Yeah. Always feeling like I got to stretch those hip flexors. All right. Okay. So Thomas Myers is an anatomist, and he is one of the first people that published his ideas. And now a lot of people have done research based off of them, and clinical research where we've found that these ideas work. Okay. So chronically tight hip flexors actually are because the hip flexor is tired. It's not tight, it's taut because it got tired, because it's overworking. So if your hip flexor is overworking, the reason for that is because the muscles on the back of the body have gotten weak and the muscles on the side have gotten weak, and the timing of the way your gluteus maximus muscle works, the muscles in the back work, and your transverse abdominis, which is a basically natural weight belt muscle of your body, the timing of how all those muscles work together and the strength of them has gotten into an imbalance. And that is actually what's causing the hip flexor to take over and try to compensate for these other muscles that have gotten too weak. And then it gets tired because it's trying to do everybody else's job, gets tight, compresses the joints, and it can cause hip pain, can cause a pinching feeling in the hip. So if anyone ever, like, this is a really common one with hip pain. If you're laying on your back and you bring your knee towards your chest, doing that stretch, it feels like a pinch in the front of the hip. Anyone ever felt that before? So if that's something that you have experienced, a lot of times that actually is related to hip flexor tightness. And what Thomas Myers discovered is that it's the craziest thing, but the back of the body, so you have fascia that runs from your eyebrows all the way down to the bottom of your feet. And then you also have fascia that runs from the bottom of your feet up your inner thighs. It comes actually from the bottom of your feet around the outside of your thigh, your shin, and in the inner thigh, and then it goes deep into the front of your body. And on that screen, you can see some of the way that he's identified the way fascia is connecting groups of muscles together. And so there's a spiral line. You can see the one where the fascia is crossing. All right, that's the spiral line. And then there's a deep front line. And so what Thomas Myers theorized is that if we release the muscles in the back of the head, it's going to help everything on the back of the body to actually release. So, for example, the hamstrings are connected to the tightness in the muscles up here in your neck. Okay. In the same way, if you have tightness in the muscles of your feet, it's going to cause tightness in your hip flexors. Also, because of the way the spiral line is connected and the deep front line is connected, which the deep front line is, if you're looking at the screen, I think it's the far right picture, where you can see that there's blue around the neck, and then there's blue, a lot of blue in the front, the adductors here, and then below the rib cage. So that's the deep front line, and your psoas is part of that. So your psoas is actually connected to your neck. So just try this. Try sticking your tongue out and go, ah. All right, can you feel your abs? Can you feel something? There's something happening in your stomach area. All right, and that's because that's your deep front line. That's connected. Your tongue is actually connected to your deep front line. All right, and so are the muscles in the back of your head. So I'm getting to this because it's really interesting that releasing the suboccipital area, the muscles at the back of your head here, will release your hip flexors. It will also release your hamstrings. And they've done research studies on this and found it to be true. And so when people come here for physical therapy to solve their problem, whether it's hip pain, back pain, whatever, everybody needs to be doing a release to their suboccipital area to help their hips and their back. All right. The back and the hips are always linked. So if you've got hip pain, there's going to be something going on with your back that's contributing to it, and vice versa. So I want to show you some things that you can do that are very simple to help this. And that's where the MELT method really comes in some of our group classes that we offer. It's a simple way that you can relieve pain and stiffness using a soft ball, using soft rollers. And that's a really important piece of pain relief and gaining balance back into your life. One of the things that's really important to understand about fascia is that a lot of the problems people have with aging are really because they just don't know how to take really good care of their body. They haven't been taught the best methods that are now available to us based on the recent science. And so it's kind of like back in the day when people went to the dentist, they would, what going to the dentist meant, like way back in the 1700s, it meant going to just get your teeth pulled out because you got old and your teeth got old, and that's what they did. Well, now we go to the dentist hopefully twice a year for cleaning. We're brushing our teeth hopefully twice a day. We're flossing hopefully twice a day. And all of this to keep the health of our teeth good, right? It's the same thing with fascia. If we're not taking good care of our fascial system and our muscles, then we're going to have degenerative joints, and the joints are going to start to cry. And if you already have degenerative joints, you can actually get a lot more life out of them without needing surgery if you take proper care of your fascia and your muscles. And so a big part of what we're going to talk about today is practical ways to do that. And everybody likes the feeling of a massage The melt feels like a massage. It feels so good. Everybody likes that. And not everyone likes to exercise. I totally understand that. I happen to love it, but I know that many people don't. But it is just as important as brushing your teeth and flossing, that you're doing techniques to help keep your fascia system healthy, but also to keep the muscles as balanced as they should be. And there's a lot of myths about what proper amount of exercise actually is, and which kinds of exercises and stuff. There's a lot of misinformation out there, a lot of myths. And there's a lot of people in pain who are currently going to the gym and working out, and they're still in pain. And so it's obviously not working for them. Something needs to be different. So that's what we're going to talk about, is some different ideas. Let's go to the next slide. So common contributors to hip and knee pain include muscle imbalances, which I've talked about a lot, tissues that get too tight, joints that don't move right, and that can be a really key thing. Sometimes you might have a jammed joint in your back that's causing your hip to not be able to function right, because the nerves that come out of your back and go down into your hip and your leg, if there's a pinched nerve up in your back because the joint is a little bit jammed and not functioning right, then that can cause the muscles to be weak around the hip. And then that can cause the hip to stop functioning as well, because the joint is getting jammed because the muscles aren't supporting it. And you've got a whole domino effect, right? So whenever somebody comes in with hip pain, I always look at their back. If someone comes in with back pain, I always look at their hip, because there's usually something going on with each one that's affecting the other. Same thing with the knee. If someone comes in with knee pain, I always look at the ankle, and I always look at the hip, and I look at the back as well, because they are so connected. I always actually look at the whole body, because like we just talked about, releasing the suboccipital area has an effect on giving you instant hamstring length, as well as a better hip flexor length, just by releasing the suboccipital area. So I'm going to teach you a way to do that for yourself today, so that you can start keeping that area a lot more mobile, because it's so important. Sometimes you can have the bones, because the tissue's gotten so tight and glued, the bones can be in a little bit stuck in a little bit improper alignment. And so there's a way that I can very gently get that alignment back really quickly, which we do in the clinic if somebody's got that problem. Because if that bone is a little out of alignment, it's going to actually affect the flow of communication between your body and your brain in a negative way, and it's going to throw off your whole body. So just think about this. Your eyes, they always are going to try to keep you looking at the horizon, all right? And I'm going to exaggerate it. Let's just say that the bones in your upper part of your neck are causing your head to be kind of pulled over to the left and a little side bent. Well, guess what your body's going to do to compensate? Because your eyes always need to be on the horizon. Your body's going to do something like this, okay? And I'm exaggerating it, but it's going to subtly do that, all right? And then that's going to be causing problems in your spine that can actually cause hip pain and can cause knee pain. So many people that have knee and hip pain, they also have a problem up at their neck and head. I always look at that. I always address it. And then just from releasing the tightness in the upper part of the neck, the rest of the body falls into better alignment. It's really fascinating. So when we're solving hip and knee pain, being comprehensive is actually really important. A nervous system that makes pain when it doesn't need to anymore is also sometimes a cause of pain. When you've had pain for a long time in a certain area, then the body gets used to that being the case. And so it starts to create these protective mechanisms so that your brain and your body relate with each other in a way that's changed. And now it's hyper protective. And so because of that, simple things that didn't used to cause pain start to cause pain. And there's actually a specific type of treatment for chronic pain. It's called chronic pain syndrome. And there's specific type of treatment that we do here that has very good research validating that it works. And it's been used all over the world, but it's not being used in very many clinics yet. insufficient rest and recovery activities is a really big deal. So think of it like this. If you just constantly were eating, and never brushing your teeth and flossing, well, your teeth would just start to get really gross and corroded. And it's like that with our body. If you're using your body all the time, but you're not putting back enough to restore it, then you're going to have a breakdown. So today I'm going to give you guys some strategies to be able to restore your body in some simple ways. All right, inflammatory food is a big one that can really contribute to pain. I've definitely had clients who have told me that just by cutting sugar pretty much out of their diet, except for occasional treats, but not getting it on a daily basis, and also by cutting out nightshades, anything from the nightshade family, and really decreasing the amount of grain consumption, their aches and pains have really gone down. Alcohol is an inflammatory food. So is fried food. Fried food will instantly harden your arteries, and it takes several hours for your body to reverse that effect. So it's definitely a very inflammatory. Inadequate nutrient intake is another one. So if you're not getting enough of the phytonutrients, you're not getting enough, vegetables especially, super important. You're not getting enough of the proper nutrients in your diet, then your body can't repair itself well. And I know that there's different kinds of diets out there, different approaches to eating, right? I know there's the carnivore approach. I know there's a total vegan. There's all these different approaches. And to some extent, you have to do what makes sense for your body and for your genetics. So I'm not super rigid on that. But the most important thing is that you're getting adequate nutrients. If you're not getting adequate nutrients, you don't have the building blocks to build the muscle strength that you need and for your body to function properly, for your nervous system to function properly, and all of that. All right, and then digestive system problems can actually cause tightness, chronic tightness in your lower back, which can then cause hip problems. So a lot of people don't realize that, but the same nerves that innervate your lower back also innervate your stomach, your digestive system. So if you're having chronic digestive system problems, that can actually be causing tension, tightness, or even pain in your back. And that's an important thing to understand. So let's move to the next slide. So just a really key concept to remember is that the painful area is usually the victim, not the cause. Usually the hips and the knees are the victim, not the cause. I have this distinct memory during COVID of a patient who came in with hip pain, and she had been spending a lot of time on her laptop at her table in her kitchen, working like this. And so she was there for hip pain, but part of the problem for her was that because she had been doing this, she had gotten so tight in her suboccipitals of her neck. And so we needed to release her neck so that her spine could release, so that her hip could release. And so it was actually starting to create more problems. She was having knee pain that started, first was the hip, then the knee. So that's why it's really important to understand that there can be root causes to pain. It's not always right where the pain is. Okay, let's go to the next slide. So these are some common hip ailments. And some of you maybe have been diagnosed with this or heard of it before. You've known someone who was. And all of these conditions can be prevented or treated with a lot of these methods that we're going to talk about today. All right, let's move to the next slide. So the root cause of most hip pain is inadequate spinal stability. And then also spinal segments can get stuck. And if they're not moving properly, then that will cause a tight hip capsule. You have a capsule around your hip, so the hip can't work right. And muscle imbalances that are for the muscles that are supposed to be supporting your hip can also create pain in the joint. So these are the most common root causes of hip pain. And I would just put the inadequate spinal stability or spinal segment stuck Think of the spine, not just down here close to the hip, but all the way up by your head. This is really important to take away, that keeping the fascia around your neck loose is important for the rest of your body. All right, we'll go to the next slide. So common knee ailments. These are also probably things that you've heard of, things you've been diagnosed with. And again, these are all different conditions that can be healed with natural approaches. Sometimes people do need surgery. And if you end up needing surgery, then you definitely want to understand a lot of these concepts and see someone who understands them as part of your care, part of your process of care, in order to prevent a future surgery, and in order to get the most out of the one that you're having as well. Because surgery isn't an automatic that you're going to have it be successful or that you're going to get the result that you want, because there's a lot of work that goes into it after surgery to get that result on your end, and with the clinician, whoever you work with, who's supporting you and guiding you in that. All right, let's go to the next slide. Patellofemoral syndrome is a really common problem, and a lot of times when people have pain around their kneecap, then they get diagnosed with patellofemoral syndrome. And really what that boils down to is usually that we need to have better stability in the hip and in your back and your core, depending on how you define the core. Some people define the core as including muscles on the back. So just because you've been diagnosed with this, it doesn't mean focus on just right around the area. A lot of times it's really important that we're addressing the whole body, not just up above. I haven't talked much about the feet, but I'm going to. The foundation of how your foot connects with the ground is also really important for everything that we've just been talking about, and even as much as step length. So I regularly talk to people about you're walking wrong. And if you can believe it, it's possible to walk wrong. And so making sure that your steps are not too far out in front, so that your step should be just barely in front of your other foot. And if it's too far out in front, then that can be causing strain on your hip and your knees. All right, so let's go ahead and move to the next slide. Root cause of most knee pain is poor ankle and foot stability. So if you've ever sprained an ankle, if you've ever injured your foot, so give me just a thumbs up or wave if you've ever sprained your ankle, injured your foot, ever had anything step off a curb wrong, tweaked it somehow. That's definitely happened to me. Yep. And if you didn't do specific exercises to get the stability back in those muscles, they don't naturally come back on their own. They typically go into kind of a spasm when you injure that joint, and then they never fully come back alive and awake. And they've done research on this on young athletes, even young athletes. If they go back to their sport without doing a full rehabilitation to get all the muscles firing correctly again in their ankle and around their ankle, then it contributes to future problems with knee injuries and future ankle sprains and foot pain as well. So it's really important to get all of that back online. And many times people just have no idea and they just don't do it. And they're having problems that stem back to something that happened when they were 15. So that's really important to understand. We're going to do something about that today. Let's move to the next slide. All right, so the first step is always identify the root cause or causes of your pain. All right, and then we're going to go to the next slide. The second step is to begin treatment for each root cause, and oftentimes it's a multi-step process, and working with someone who has done this before and knows what process is most efficient and works well is gonna really benefit you a lot. There are some cases where a problem has been chronic for a long time that sometimes can take years to fully resolve. But most of the time, what we see is that it takes weeks to several months to resolve most people's pain and problems. All right, we're going to go to the next slide. All right, so let's get into a little bit of practical tips, shall we? So I want to talk a little bit. Oh, actually, you know what? Eddie, can you grab for me? I'm going to talk about these, but can you grab the little wash off? I think we've got one in that box right there. Yeah, yeah. Okay, so there's multiple things that can help to promote good mobility in your tissues. So the melt method is something that we teach here in classes. And if you see the roller, you might be thinking, perfect, thanks. If you see the roller, you might be thinking, oh, I know what this is. It's foam roller. I've done that before. It's kind of painful, but it sort of helps a little. This is different. It's a soft roller. Okay, see how it bends? So it's soft and it's got a little give to it. So when you lay on it, it actually creates just a little bit of a gapping for your joints. And because it's a little bit soft but still firm, it actually allows your soft tissues to sink down over it so that you can get a better release. When you use a hard roller, it's a more intense experience, but it's actually not better. The soft roller works better. And it's because your tissues can relax a little bit more so you can get a deeper release. The melt method is also just designed to release your nervous system. So it's not just rolling your body, ironing it out like a shirt. It's really intelligently designed exercises. I say exercise, you're not going to sweat. It's intelligently designed movements to release joints, to release fascia in these specific ways that are different than the way the typical physical therapist or chiropractor or doctor is going to think about the body, because most of them have been taught on a paradigm where we ignore fascia for the most part, or we don't understand how fascia is connecting muscles together. But if you understand the way fascia is connecting muscles together, and you understand the concept that releasing the suboccipital area, for example, the upper neck area, is going to improve hamstring flexibility and hip flexor flexibility. If you understand that concept, then that's just one of many, many concepts. So releasing your feet also is going to release tension in your hips, your knees, and your back. So just by doing regular release of your feet. In the melt method, we have these little soft balls, and they're better than a tennis ball or a lacrosse ball. It's squishy, okay? And the softness of it allows for a better release through the tissue. There's also a specific pattern for how to do it. I just had a young man who was here, he's in his 40s, and he had carpal tunnel syndrome, and he was visiting. He was here he saw me for 4 days. He saw me 2 hours a day for 4 days, and went from numbness, tingling in his fingertips, and locked up through his neck and upper back, to no more numbness, tingling in his fingertips, and no more locked up. And he just said, I feel like I can stand up straight and I don't even have to try. And he was really amazed at the transformation of just 4 days and just coming for 2 hours a day. He was here about 3 hours total, but he's with me for 2 of those hours. And a big part of what we did is I taught him how to use this soft roller and these soft balls. And so it's really life transforming. He was super excited. For me, I'm excited about it because 5 minutes a day will change your life of incorporating a little bit of melt. And then if you do about 40 minutes to an hour on the weekend of some melt, and they'll like a specific sequence, either do a class or learn what you could do yourself by working with me or one of my instructors to get your own personalized program. And melt is huge. That's why I'm spending some time talking about it. It is life-changing. Because I'm super active and my job is physical, I used to get a massage twice a month because I just needed it. Well, I haven't had a massage in like a year because I don't need it. I'll maybe go just for fun, but I just don't need it because I literally haven't had to go get like a maintenance massage in years. And it's because I use the melt roller, I use the soft ball, and I also use vibration. So being strategic with the way you use your vibration is really important. So there are different tools out there. There's this, I really like the Pure Wave. This tool is awesome. So it's a Pure Wave technology. And the thing I really like about the Pure Wave is that it has multiple vibration frequencies. And frequency is really important. I did my doctoral research on vibration technology and using it to promote healing. So I learned a lot about it through that process. This tool is my favorite one on the market because it has the most variability in the different frequencies, because different frequencies do different things. So with this one, there's this end right here that you can use. And you can actually, it's vibrating right now. You can use it on your face to help fluff up the fascia of your face, make it more youthful. Who doesn't want some of that, right? And then also you can use it right on the back of your head, very gently. You can use it right on your neck. You can use it on your head. And it's very, very, very subtle, and it's gentle enough to use in those ways. The other thing, and I was just literally using this last night on myself because I surfed too much, had too much fun. I was sore. I feel better now. It really helped. Being strategic about when you use the vibration is super important. So using vibration as soon as possible after you exercise is going to help your body to repair, refresh, rejuvenate. And if you use it before you exercise, you want to turn it up really, really high. And the reason for that is because it's going to help connect your brain with your muscles so they're ready to perform. So you want to turn it up high and use it on the big muscles. Okay. So that's with this tool, where I would do this side, and you can hear it's like, whoo, really loud. And I'm going to use it just on my big muscles. All right. And literally I'll be at the beach about to go surfing, and I just have my massage gun like this, my handheld tool, and I'm standing there watching the waves, and I'm just using it all over my big muscles. Okay. And it's going really, really intensely. So before you exercise, even if you're not surfing, let's say you're just doing some floor exercises, make sure you use some vibration, get it going as high as your body can tolerate. And especially the big muscles, especially your butt. Okay. So if you find that you're constantly having back pain or cramping in your hamstrings when you're trying to do, for example, a bridging exercise, any kind of lifting your hips up kind of exercise, if you activate your butt muscles using this first, then you're going to find you're going to be able to do it. I use it. It's a trick I use in the clinic. Okay. The one key thing as we're getting older is sometimes our tissues don't tolerate as intense vibration as the younger tissues do. Okay. It's just like as you get older, your skin gets thinner, right? Maybe not figuratively, but definitely physically. Okay. So I've found that like the Theragun, it's a good tool. However, or some of those guns by Sharper Image, those kinds of things, they have their intensity can be pretty high. So when I say use a higher intensity, for you, that Theragun, the lowest setting might actually be as high as you should ever go for your body. And if you're over 60, you may want to consider getting a different vibration tool in addition to the Theragun, because the Theragun doesn't get down as low and as small as the Pure Wave. So the Pure Wave is better because it has vibration levels that are lower and smaller, and that actually allows your fascia to release better. It really does. It's a game changer. This tool, I can't recommend it high enough. It's a really, really good tool. There are these balls, which are nice. I have them as well, vibrating balls. I like a ball because it's passive. You can lay in bed, and we have a whole sequence of things you can do with the ball. And the thing about vibration that's so important is everyone should be doing at least 3 days. Do some vibration about 3 days a week. So lower body at least, because if you vibrate to the lower body, then it's going to release your upper body. People who do it at least 3 days a week, if they stick to it for 6 weeks, they're telling me I feel 10, 20 years younger. I'm serious. It really makes a difference because it causes your body to release its own slidey glidey stuff that makes your muscles and fascia slide and glide better. It also loosens up stuck layers. And that slidey glidey stuff is called hyaluronic acid. You can take it as a pill or just get your body to produce it naturally using vibration. Okay. I used to take it as a pill. I don't now because I use vibration. So save yourself some money and learn how to use vibration really strategically. So I, for myself, have the Pure Wave. I also have these balls, and I have all the balls because they do different things. But you could pick one, all right. And I would say if you're gonna pick one, it kind of depends on who you are. But if you are a larger individual with a lot of like muscle mass, then this one, it's the Hypersphere. The Hypersphere is a good ball for someone who is a lot of muscle mass, larger, thicker person. It's pretty intense, and so if you already have a Theragun, it's kind of in the same family, and it might be better to get something that has some different variability, like the Milestorm. This is got a little bit more variability to it. It can do a lower vibration, as well as that more intense vibration. And this is the most gentle one. So if you have fibromyalgia, or if you have more sensitive tissues, then the Vulcan Actisphere is a really good one for you, because it's a very, very gentle vibration. And it can go up higher, but it's got a super gentle component to it. One thing that is really important to understand with vibration is, think of the concept of a drum. If it's really stretched out versus if it's not. So if it's not really stretched out, then it can really move a lot, right? If it is really stretched out, there's not a lot of room for movement. So when you're doing vibration, if you buy a vibrating ball, then a lot of times they're going to send with instructions, and the instructions are going to show the ball up against a wall. They're going to show the person sitting like this. But here's the problem with doing it that way. If you're sitting like this, the vibration stops at your hip, okay? But if you lay down and put it under your leg, laying on like a bed, not a bench like this, then the vibration is going to flow through your whole body. So we have a whole sequence that we've developed that I created that works really well for releasing your whole body, much better than the instructions that come with the tools. And we have it for the handheld tool as well. So if that's something that you would like us to send to you, then just email us after this and we'll send that over to you. Okay. In addition to the vibration, I spent a lot of time talking about it because it is really pivotal. There's this thing called instrument-assisted soft tissue mobilization. So you can use a tool shaped like this. It's called a gua sha. All right. And this one's pretty much an all-inclusive. So you could buy a kit that has multiple different types, but if you just buy this one, it's good enough. And it costs like around $8. And I have videos on how to use it. And so you can actually use it to release your suboccipital area. I do this several times a week. Okay. You can use it to release your arms. All right. You can use it to release your neck, even your face, to help promote just more youthful appearance, but also just is relaxing. Releasing your jaw using the gua sha is going to release your neck because they're connected through fascia. Okay. So the gua sha is a helpful tool. It doesn't take very long. It's very, very quick to get the releases. And I especially recommend it to everyone for releasing that suboccipital area that we were talking about earlier. And so you can buy one of these on Amazon. And so if you're interested in learning more about how to use the gua sha for releasing your fascia to help decompress your hip and your knee, if you're having pain in either of those spots, then just email us and we'll send you instructions on where to buy the tool, which one to get, and how to do it, how to use it. Okay. So other than the gua sha, other tools that can be really helpful for putting back to your body is actually repair your body, for example, using frequencies. So this is game-changing stuff right here. So the eye care can run off of an iPad or a phone, and this tool I'm seeing amazing results with this. I use it every day. We're using it in the clinic. People are buying them and using them at home. It's programmed by me, and you buy the machine from the manufacturer, then I program it for you. This can actually stimulate your body to repair cartilage. It will stimulate your body to repair tendon, and it's really hard. The body doesn't naturally repair its cartilage or tendons or soft tissues. I'll get to your question in a second, Kathy. The body doesn't naturally repair tendons or cartilage very well. And the reason for that is because there's not a lot of blood flow in a lot of these areas. But using this tool, we can stimulate repair and sort of bypass that natural limitation. It's awesome. We can repair any tissue, stomach tissue, intestinal tissue. So the whole thing about you could be having stiffness in your back that's affecting your hip. Think about it like this. You might have 8 problems that are causing your hip pain, right? And so we kind of have to prioritize what's the worst one, put out the biggest fires first. And this tool is really helpful at putting out lots of fires at once. In addition to a comprehensive plan that includes melt, includes the gua sha tool, includes getting into a rhythm that's good for your body. Just like you have a time when you brush your teeth in the morning and the evening, you have a time that you set aside to go to the dentist and just get cleaned, that kind of thing. It's like, okay, get into a rhythm that's healthy for your body, for longevity, be able to really enjoy your life long term. Getting into those kinds of rhythms makes all the difference. And it's something that we help people with here every day. So if you're feeling overwhelmed after this talk about all the things we talk about, then you can just get with us and we can help you kind of start a process that would make sense for you and work for you. The custom care, this tool is a more expensive tool than the eye care. It runs with electrodes. The eye care is just a pad that you just need to have on you or near you. It's really easy to use. I just have it next to me while I sleep. That's the most of the time when I use it. Most of our clients do that. And it's awesome. It's repairing my body while I sleep. It even helps to repair your brain. It's a wonderful tool. The custom care does everything the eye care does, but it also does more. It repairs nerve and spinal cord tissue, which the eye care does not. And so sometimes hip pain is because of pinched nerve in your back. It can be because of inflammation in the nerves. It can be because of degeneration of your nerves and spinal cord. And so repairing that degeneration makes a big difference. And this tool can do it actually very quickly, very well. That young man that had the nerve damage in his hands, I mean, he was feeling awesome in just 4 days of treatments. So it's pretty powerful stuff. All right, and the newbie as well. We use the newbie to help get your muscles awake again when a lot of times they get sleepy. And I don't actually recommend a lot of stretching because usually if you're doing the right muscle stabilization and you're using vibration, you're using ISTEM, you're using the melt method, then the stretching you need is incorporated into all of that. The mobility that you need is going to come from that. And a lot of times people think if I have pain, I need to stretch more. Not necessarily. You might actually need to do strengthening more. And there's really specific stretches that I recommend for everyone for their health. And it's not many, because a lot of times what people need is they need strength with length. So I will give people active activities that are stretching the muscle while strengthening it. And then you're getting 2 birds, 1 stone. So much better. Okay. And so that's where you can learn some of that stuff in our group classes, or you can learn it with doing a private session. All right, let's move to the next slide. So improving muscle balance, you want to do the appropriate exercises to support your activity level and do them correctly. So the stuff that worked for you when you were in your 20s, probably not the best thing for you when you're in your 50s. Maybe some of the same things, but there's going to be a difference in the way that you should be strength training your body. And I've heard people have come in to see me who are in their 50s and 60s, and they said, my trainer said, I'm not trying to throw a trainer under the bus. Not all trainers, there's some really good ones, right? But, they'd say, and I hear this a lot, so I'm just going to put this myth to bed and say, go to sleep and don't come back. the myth that you need to lift really heavy weights or jump or run to build bone mass. That is not true. All right. You can build bone mass with Tai Chi, which is not heavy weights. Okay. So it's all about just getting your muscles to be activated and getting them in a global way, as many muscles as possible to activate. And that's a big problem with people's exercise routines after the age of 50. Something called sarcopenia happens, your muscles begin to waste, and you need to have all the muscles of your body activated at some point, a couple times a week, or you are going to be losing strength and your joints are not going to be getting the right mobility. If it's once a week, you're going to maintain. If it's twice a week, you're going to gain. Okay, so once a week maintain, twice a week gain. If you want to gain, you got to stimulate the tissue twice a week. Including single limb activities and multi-joint activities is really important. And most people, a lot of people, when they do their strength training, they're doing it double arm, double leg. You are missing out on key things that you need for the health of your joint if that's what you're doing. And a lot of times people think they need to train with free weights like dumbbells and things like that to be strong. And I will tell you that I never use dumbbells. I mean, sometimes I will for fun, but I can be very, very strong without regularly using dumbbells in my routine. You can do it with bands and body weight. And I'm very, very fit and strong. So basically you want to think of this: strength train for 30 minutes, at least 2 times a week. Now that 30 minutes can be split into 10 or 15-minute sections. You could do 10 minutes a day, whatever, but you just got to get the stuff in. And I've come up with a system where it's like, all right, if you just invest this much time and do these exercises, your body will be as balanced as it needs to be moving forward. Also, ideally, you want to walk or do cardio in 30 minutes, 5 days a week. And you might have to start with 10 minutes, 15 minutes, but you want to build up to 30 minutes. And that's going to build strength and endurance. If you have arthritic joints, you may want to consider aquatic exercise, because research has shown that people with arthritic joints and fibromyalgia as well, 2 different categories, but people can have both. People with fibromyalgia or people with arthritic joints tend to do very well with aquatic exercise. So that might be something to consider looking into. Okay, let's go to the next slide. Barefoot Science insoles, don't miss this. If you don't have Barefoot Science insoles, then I really recommend that you get some. They actually strengthen your feet and your legs just by wearing them. I've got them in my shoes right now, and they last a really long time. I've had mine for, I think, 6 years now. So they're a good investment, and they're not super expensive, and powerful tool for promoting the strength of your feet, which is actually going to translate to strength in your legs and hips. And they've done research studies on this, found that after wearing these, people's leg muscles got stronger just from them. And they showed that there's this thing called EMG where they can measure the electrical activity of the muscles. And they showed that the electrical activity in under-functioning or sleepy muscles increased by just wearing the Barefoot Science insoles. So I recommend them for everyone. The Therapeutic Plus is probably the best for most people. And so that's what I would recommend that you get. All right, let's move to the next slide. Common exercises that are good for some people, but you need to do other exercises also. So the sitting in the gym and doing the knee extensions, stop doing that if you're doing it. The only time that I would ever recommend that exercise is if somebody is rehabilitating from a knee surgery. At a certain point in the rehab, it can be helpful. Otherwise, nobody should be doing it, because that exercise puts a tremendous amount of load and shear on the knee joint. So just stop it. Don't do that. Okay. But there's plenty of other things you can do to strengthen your legs. The kettlebell, I went through there was a kettlebell craze years back, and kettlebell, it is a fun, novel way of exercising. It can be really good, but this exercise, really common with the kettlebell, yes, there's good things about it, but a lot of people who have hip and back pain and knee pain should not be doing it. So I would say don't do it unless you're working with if you have pain in your hip and back, stop doing that exercise and until a physical therapist says it's okay for you to do it. All right. The leg press where the weight is up above your head. If you're at the gym and you see that kind of leg press, just don't do it. There's something else you could do instead. You can actually be quite strong by doing, put like a ball at your back, and then you're gonna squat. And you can, if you want to, you can do dumbbells. You can hold dumbbells in your hands, and as you squat, do a bicep curl. You can even go into a bicep press depending on your strength level, that kind of thing. But just don't do the leg press with it over your head because it puts so much pressure on your back. It's just not healthy. And just for example, you could do literally, you could have some dumbbells in your hands, and you could do sit down, curl, stand, and press. Do something like that. All right. You can get a band, put it on your knees, push out into the band so you get more activation on your glutes, and then you can progress. You can also progress to doing it single leg. So you can work on doing. You want to get to be strong enough to be able to do this, right? But if you're not strong enough to do that yet, then what you could do is you could go down on one leg part way, and then put your other foot down and sit down. That's one option to do a single limb activity. The other option for a single limb activity for strengthening your legs is just to do a partial lunge or a full lunge. The squats with a bar across your back, great exercise, but not appropriate for everyone. And you really have to have perfect technique. And so if you're having hip or back pain, I would not recommend that exercise for you until you're cleared by a physical therapist to do it. Same thing with deadlifts. You know, that deadlift exercise, it can be a good exercise, but the thing I don't like about it is if you have any imbalances, then if your stronger side is going to take over for the weak side's never going to get stronger. Okay. So it's important to do something where it's more single limb. Okay. So even if you aren't super mobile, you could do something part way like this, where you're just reaching part way down your leg. Okay. It could be very small, or you could reach for a counter, something like this. Okay. That type of activity for building the strength of your butt and your back is much better than doing something with weight like this. Okay, let's move to the next slide. So these are just a few pictures of some of the kind of concepts that I just described. And it's really important for the health of your knee that you're getting enough strengthening of the muscles on the back of the body. So just think of this, the ratio of 3 to 1. You want to be strengthening. You want to do 3 exercises for the back of the body for every muscle exercise that targets the front. So squats tend to be more of actually an exercise that is more of a quad dominant activity. And there's ways you can do it that target more of the glute, but it does tend to be more quad dominant. It is really important to do more things for the back of the body. So something like this, that's back of the body. And then also you can see the picture with my foot on a ball, lifting up, doing curls, things like that. You can do it with just your foot on the ground. That's a more advanced version of the foot on ball. All right, let's move to the next slide. So the newbie, I mentioned it a little bit earlier. It's one of the ways that we're able to get really fast changes here in the clinic. It does actually accelerate repair of cartilage and tendons. But then the other thing that it does is it basically reconnects your brain with your muscles so that they can fire stronger than they naturally would have been able to because of injury or pain. And so if your hip or your knee hurts so much that you really can't lift heavy things or do hard exercises, we can put the newbie on, and then you're able to actually do those things and build that muscle strength much faster than you could without. I find that we're getting results in half the time that we used to, which is really fun because I just love to see fast results. So it's a wonderful tool. All right, and that one's an expensive tool, so it's not really a home tool, but it's definitely where we use it in the clinic. All right, let's move to the next slide. So just keep in mind, there's no quick fixes. There's no easy button to getting out of pain if you're in pain, and especially if you've been in pain for a long time. But there is a path, and there is a way that if you start doing some of these things that I'm talking about today, you'll start to see progress, and that'll encourage you. So even just people who are in a lot of pain, they come to a melt class, and then they're in much less pain, or they're completely out of pain and they're blown away. This is true. This happens. And that just tells you, okay, I'm on the right track. This is something that's good for me, and it's something that is going to start to make a difference. All right, let's move to the next slide. So I just want to talk about how to know you're on the right track with the treatment, when I know it can be kind of hard to determine where should I go? Who should I trust? There's so much information out there now, and anybody can start a YouTube channel. There's a lot of information on social media. Your doctor's telling you one thing, you might see a physical therapist or a chiropractor that says something. So how do you know you're on the right track with treatment? Well, usually what we want to see is that symptoms decrease in 1 to 6 visits. So you're seeing some symptoms improve. And you also want to see that you can do activities more, you can do them longer, and you can do more activities 2 to 4 weeks after starting the treatment. So that's telling you, okay, I'm heading in the right direction, especially when you've had pain for months or years. It can take months. It can take weeks to months to get to where you're really feeling like you're out of the woods, okay? But what you want to notice is that, oh, you know, I'm noticing symptoms decrease in 1 to 6 visits. I'm noticing I can do activities for longer. I'm having less problems than I was before. Then you know you're on the right track. You also want to notice more pain-free range of motion than before. Sleep is huge. If you're not getting good sleep, you're miserable, right? So your sleep quality and your quantity is better. And, you know, what we tend to see is people come in and they kind of are like, they're really, I can tell they're not their best self when they come in at first to see us. But within their first week or 2 of treatment, they're starting to smile more, and you can just tell that they're their better version. They're the version of themselves, their ideal version that they like to be and want to be. And it just allows you to be there for your relationships and have more capacity for people. You're going to feel stronger. You'll feel less afraid or not afraid to try things or do things that you used to fear doing because it used to cause pain. And you may have some pain or fatigue or soreness after a treatment session, but that should go away within 1 or 2 days. And you will notice usually right after the treatment session feeling so much better. And then if you're kind of sore the next day, it's like, oh, this is a good sore. It's like, okay, just the body's adjusting and getting used to new way things are. Sometimes soreness after treatment also is related to the chemical processes that happen as a result of releasing the layers that have gotten stuck together. Then the byproducts of cellular metabolism, which is toxic, it gets released into your body, and then that your body reacts to the toxins by making pain. But that passes, it goes as you drink water, and it goes away within a day or 2. So that can be one of the causes of some soreness after treatment. All right, let's go to the next slide. Okay, so some key takeaways. We're coming in for a landing. Make sure you maintain the flexibility of muscles, nerves, and joints. Maintain and continue to improve strength. So single leg work is really important. Foot strength. Get those barefoot signs insoles going. I want to show you this exercise. It's something you can work toward, all of y'all. So you could put a band on your foot like this, and you're going to reach. All right. What's really great about this exercise is you're activating the muscles on the inside of your leg, as well as working balance. And if you try it, you're going to feel the muscles on the outside of your hip working too. And if you're thinking, I can't do that, you'd be surprised. I get all kinds of people in here doing that exercise. Even if you're just doing it at a very small level, like this, right? Even just very small, trying to hinge at the hip and just reach back with your leg, okay? That you're going to feel it in your hips, you're going to feel it here, working your core. Another simple exercise you can do is stand on one foot, do some little kicks forward, really focus on keeping your pelvis level. So this is going to help for those people that ever injured, sprained their ankle before. And come across, little kicks, out to the side, little kicks, back, little kicks. Try to get 10 without stopping of each direction and then switch. Okay, that is a simple thing you can start doing every day to improve your balance, prevent falls. It's important, right? And it's also going to help rehabilitate your ankle, hip, knee. And I find it helps people that have hip pain. It often helps them feel better. All right, so that's a simple exercise. Another one that you can do is just try to stand on one leg. You can stand in a corner so that you're safe, and then try to close your eyes. And if that's just frustrating, because it seems like you can only do it for like 3 seconds at a time, then do a tandem stance, and then close your eyes. And you can work up to doing a single leg with your eyes closed. So there's a couple of things, if you start to incorporate that, that's going to be really, really helpful to you. Okay, let's try that. Let's go to the next slide. Also, key takeaways on the nutrition: reduce sugar and grain intake to reduce inflammation, increase consumption of vegetables if you can, drink enough water, limit your caffeine. Also limiting alcohol intake, and fried foods are just super inflammatory. So really limiting those two. All right. Okay, so we are basically at our time. I want to respect your time. I also love to be able to answer questions if people have some questions. But what I'd like to do is do a quick little raffle for everybody who's here. Oh, we got some more. All right, so you've got to be here to win the raffle. That's the rule. Okay, so last time I didn't do that, but I'm going to make that the rule this time. Okay, so we're going to find out who our first winner is. So I don't have the prizes out here, but one of the prizes is going to be a gua sha. Okay, so that was Kathy's question. She was wondering how to spell it. It's G-U-A-S-H-A, gua sha. And we sell them here, but you can also get it on Amazon. And some lucky winner is going to win one today. So here we go. Kathy won the gua sha. That's awesome.
That is awesome. Thank you.
All right, let's find out who is gonna win our you're gonna win a melt hand and foot kit. Can you grab it? So the melt hand and foot kit is everything you need for melting your hands and your feet. And it comes with 9. Yeah, I think it's it comes with 2 sets of all the balls that you need. All right, and instructions as well. And you can always learn how to use this from one of our group classes, which you can take online or you can come in person. And it's a game changer. It's a life changer. Doing melt for your feet every day is going to help your hips. Okay, it's going to help your knees. It's going to help your neck and your back. Do it every day. It's going to help so much. Okay, and then also melting your hands is really good for your neck. And you can learn to use how the ball to release your neck as well. That's a technique you can do. I was going to show you guys how to do it today, but we're running out of time. So you can just come to class to learn. Okay. So let's find out who wins that. It's in my hand. Faye! Faye, you win! Woohoo! All right, so this is a great, it's like, all right, you're going to get a whole new set. And I know you melt a lot, so you get a whole new set of both kinds of balls. That's going to be awesome. All right, so you can have one for hands, one for feet if you want. So Faye wins the melt.
Thanks. Thanks.
You're welcome. I'm glad you won. All right, so we're going to find out who wins 5 group classes. 5 group classes you can attend online or in person. Donald, I feel like you might have won before. Did you win before? All right, the universe is talking to you, man. I don't know if the universe is talking to you, but that's really awesome. Okay, so you won group classes. now you got 10 with us, I think. That's cool. All right, man. I'm glad you're here. I'm glad you made it. Okay, I want to, oh, this is the gua sha. This is the little, it comes in a cool little bag. So Kathy will get that to you. All right. Anyone? Questions, anyone? Oh, I also wanted to mention, we are doing specials. Can you drop the link in the chat? So before we get into specials, as I usually do, so you can save on an evaluation and treatment. So oh, we got a little feedback. The first evaluation and treatment is a 2-hour experience. So it's going to be an in-depth evaluation, and then you'll also get treatment on that day. So we're doing a special on that. You can save a grip of money to do that. The other thing we're doing a special on is some individual private sessions as well. So you can check that out. And Eddie's going to drop it at the link in the chat. You can also save on a group classes. And I think we have a recovery room option we can save on. So the cool thing about the recovery room is we have, you can get custom care treatment and also the eye care along with some myofascial release using a myofascial decompression using cupping. It's very gentle and massage or rapid release technology. So you have some different options. It's a good pain relief thing. A lot of people have pain, they come in pain feeling better. So it's not physical therapy, but it is just pain relief. So that is something that's an option you could save. All right, so I'm going to open up to questions.
You did a good job of covering everything. Thank you.
Yeah. Can you help Eddie drop it in the chat? He's having a little trouble getting it. Oh, you found it? Okay. Anyone else? Any questions?
You did great, Nicole. You did so good. We don't have any questions. You covered a lot. It was good.
Yeah, I know it's a lot. And yeah, like I said, I definitely want to honor your time. While we're waiting for Eddie to drop that in the chat, he just dropped it in the chat. If you're interested in grabbing that link, I will show you this one thing. I did want to show this, and so if you need to go, but you can take your fingertips and then you just put it at the back of your head, and you're going to rub on the back of your head. Okay, both hands at the same time. Okay, and just go all around the back of your head. Then we're going to go right along your jaw. Okay, and then we're going to go along the cheekbone. And right in the middle of the jaw, and then up and down side to side. And if you let yourself feel it, you're going to feel like, oh, this is relaxing. Actually, it's kind of stress relieving, you know? All right. Then you're going to go up above your ears on the side of your head, do some circles. Okay. And then we're going to go back to the base of the skull. Doing those circles. And that's it. So it's just a simple little release. You're going to feel, oh yeah, my neck feels a little looser, feels a little better just from doing that. All right. And if you're interested in any of the more information I shared earlier, if you'd like information about how to better use vibration at home, I have an ebook on that. You can ask us. Oh, Donald, you got the Pure Wave. That's good. Right on, man.
All the information that you listed in the presentation.
Yeah, putting it into action. I love it. That's great. And you can learn how to use the iStem tool, the gua sha. iStem stands for Instrument Assisted Soft Tissue Mobilization. So you can learn how to use that, and it's a game changer. Just adding that in. It does it in a little different way than the melt balls do. So even if you do use the melt ball back here, it's good. And then using the gua sha also is good in another way. It can get in and release the fascia in these little nooks and crannies that the ball can't, and even that my fingers can't. So I use the gua sha on people in therapy a lot and get results, really great results with that. So I recommend incorporating that. Okay. And it's really important. A lot of times your fascia is getting tight and stiff because your muscles aren't stabilizing you right. So getting the right exercise routine for you and for what your body needs and for what you're trying to get back to doing is really important. Okay. Everybody has a little bit different needs there. All right. Well, if nobody has any further questions, then let's all get to our Saturday. Thanks for taking time. I really appreciate all of you guys coming and taking the time, and it's been fun to be with you.
Thank you,
We
Dr.
appreciate you too.
Yeah, thank you.
Take care, you guys. Bye.
Bye.
Bye. Okay, where's that?